Good afternoon. My name is Dr. Roland Phillips, and I'm coming to you from Desert Dove Health Alliance. And what I'd like to share with you today is a recent study that I read from Ontario's McMaster University on how exercise improves skin not only for looking good, but on a microscopic level, it actually helps the tissue be solid and healthy. There was a study done on 29 men and women ages 20 to 84, and these individuals exercised regularly, and they had the skin, the people who exercised regularly had the skin on a microscopic level of people half their age. And then what they did was they took people 65 years and older who were sedentary, but over a 3-month period they put them on light to moderate jogging or bicycling just twice a week. And then they did before and after biopsies. They took skin biopsies and they looked at what's going on microscopically in the skin, and they found that the skin had changed in health microscopically. So what's really happening from my perspective? Well, we know that when you exercise, you're going to increase circulation. So circulation is going to be bringing blood, and it's going to be bringing oxygen and nutrition to the tissues. So that's a win. The other thing is it's going to decrease the amount of acid in the area, because as we bring these vital nutrients in, the body can buffer the acids and getting them out, and then we have a better lymphatic system. But what also they're thinking is that there's a different biochemistry called myokinins, and these myokinins have very positive beneficial effects on the microscopic level. So what can we do in our lives with our diet and supplements? First of all, we know that the more green we put in our life, chlorophyll is literally the lifeblood of plants. And the only difference between our blood, the iron in our blood, and the magnesium in chlorophyll is just one molecule. It's iron and it's magnesium. So we know that chlorophyll is a very powerful health-enhancing substance for our lives. We use Alka Green in our office and trace minerals. Now here's another twist on the skin. In Oriental medicine, the skin is the indicator organ for what's called the metal element or lung and large intestine. So if there is an imbalance in the lung or large intestine meridian, many times people will have skin problems, or anywhere that those meridians go, typically down the front and the side of the arms, they could have a problem. So weightlifters could have a problem with their bicipital tendon. So as we start to look at the body from a whole, we start to get a different perspective. One of the things that we could do if we're starting to have skin problems is we might want to do a cleanse. So we have liver and bowel cleanses that we do in the office with vegetables and with fruits and juicing. But we also have a great product from Water Health System called Alka Cleanse. And this has many different herbs that will clean the bowels. And as we start to clean the bowels, the liver and the gallbladder starts to dump. And then the body starts to detoxify on its own, and that's another way indirectly to help the skin. Let's talk about aerobic and anaerobic exercise. The exercise that they were talking about at the McMaster study was aerobic exercise. That means it's the type of exercise that we do in the presence of oxygen. How do you know that you're aerobically exercising? You can hold a conversation with the person. So whatever you're doing, you could hold a conversation. And if you can hold a conversation, what you're doing is for every molecule of glucose, you're making 32 molecules of ATP or energy. This is an anabolic or a building up activity that you'll do for your body. And it's amazing in its ability to buffer the acids. 30 times more powerful than any other buffer system in the body. When we're doing anaerobic activity, which is typically very intense activity, it could be sprinting, on running, swimming, biking, it could be heavy weights. Anaerobic activity by its nature is we're processing glucose in the absence of oxygen, so we only get 8 molecules of energy. And it tends to be catabolic. You cannot sustain it over a long period of time, and it can break the body down. And over a period of time, the body starts to literally ferment this sugar inside the cell. And then people start to crave sugar, and they're literally almost getting drunk inside their cells. So this is a question I have for you, all those who oppose aerobic exercise or are only doing anaerobic. And I'm not saying that anaerobic doesn't work. The problem is it can't be sustained over a long period of time. In my office, I treat many age group athletes and professional athletes, and the one thing that happens when they're only doing or they're doing an excess amount of anaerobic activity is they start to crave sugar. They have musculoskeletal injuries that don't heal. They start to have sleep imbalances, hormonal imbalances, blood sugar imbalances, mental emotional imbalances. And one of the telltale signs, if you're doing an excess of anaerobic activity or you have an aerobic deficiency, is that when you're lying down or you're sitting down and you get up, you get dizzy. And that's called a positive Ragland sign, and that's a sign of severe adrenal exhaustion. So what we've learned today is that exercise helps our skin on a overall level, but on a microscopic level. And from my perspective as an All-American triathlete, aerobic activity will keep you healthier and fitter without risking some of the risks that we do when we go anaerobic. A book that you might want to choose to read would be In Health and Fitness by Dr. Philip Maffetone. This is Dr. Roland Phillips at Desert Dove Health Alliance, and you have a great day.